physician and surgeon, duly licensed to practice under the laws of the state of New York? Yes, I am. What medical school did you attend? The University of Buffalo. And have you been practicing medicine since 1981? Is that correct, doctor? Yes, that is correct. Internal medicine and diagnosis? That is correct. Did there come a time that you examined the plaintiff in this case? Yes, I did, sir. What were your findings then, please? He complained when he came to me of having severe headaches. My examination consisted of doing a neurological examination on him. At that time, other than the fact he had some tenderness on the side of his head, what other things did he have, if any? Well, I observed that, defense counsel, I object to the form the court overruled. I observed the left side of his head was injured. There was a bruise and laceration there. Did you continue to observe him? I did. Defense counsel, move to strike, Your Honor. The court. Motion denied. You may answer. Yes, I saw him at regular intervals, at least one of 2 weeks for at least 3.5 months, and we watched him and observed him for any possible subsequent complications of a head injury such as a hematoma, blood clots, or a development called subdural hematoma. Defense counsel, I object to the we, Your Honor. The court. The editorial we is bad. What were his other complaints? Lightheadedness was another complaint, dizziness, and there were occasional blackouts of short duration. What is your diagnosis, doctor, of the plaintiff's condition? Well, I always felt that he had what we call a post-concussion syndrome. What does that mean? That people feel that is a nebulous expression because he is, or it is, a symptomatic entity rather than something that can be definitively ascertained by diagnostic procedures. If the patient continues to have headaches and it dates back to the accident, he continues to have other cerebral symptoms like lightheadedness and blackouts. We do feel that it is something that you cannot pick up very often on examination, but pathologically it is probably due to some trauma where there is, let us say, small vessel damage present. At that time, doctor, what signs did it exhibit to you? How did he feel? Defendant's counsel, objection. The court overruled. Let him respond. When I saw him, he was stuporous. He had abrasions on the left side of his nose and the right supraorbital region. He was restless and irritable. Doctor, I understand then you followed him up and you made further tests? Right. Would you tell us what those tests were and what his progress was, if you will? He had an electroencephalogram which showed that he had irregular slow wave forms bilaterally. It was an abnormal record. When I last examined him, he was complaining of pain in the morning, headaches about once or twice a week, described as a sensation of fullness, and within 5 to 10 minutes, a moderate headache. Defense counsel, I object. Unresponsive. The court sustained. Doctor, assuming he complains of occasional loss of memory, could this be related to the injury he sustained with a reasonable degree of medical certainty? Defendant's counsel, objection. Form is bad, Your Honor, I submit. Yes, I think that could be related. Assume, doctor, he complains of the fact that he has insomnia. He must get up many times and he still takes these headache pills. Could this type of reaction be related to a head injury of this type? Defense counsel, I object to the hypothetical in form, Your Honor. The court overruled. Well, you see, he can complain of 1,000 things. They could all be related. Factually, it is hard to prove. Now, doctor, when he had this skull fracture, the brain, of course, the brain is not anchored to anything. It is free-flowing to the head. Is that correct? Well, it is encased in fluid, yes. And when we have an injury of this type, of course, this thing gets shaken around there quite a bit. Right. It runs from one end to the other one, and shock waves now go through this brain, do they not? Very good analysis, yes. Shock waves could cause related damage to other portions of the brain. Is it true? It is not the shock It is the fact that when he bounces backwards, his brain also bounces forward in a contra coup manner. In any event, Doctor, do you think this man is malingering? Defense counsel, objection. Uncalled for. The court, I'll take it. No, I don't think this man is malingering at all. I think he has an occasional headache. I think he may have an occasional memory lapse, but this is not contraindicative of the type of work he does. Doctor, do you feel you should do another encephalogram before you could give an opinion? I think he should have another test because his last one was still abnormal. And if the present one is still abnormal, then he should be on some medication, I should think. Are you able to state, Doctor, that the complaints made by the plaintiff are causally related to the injury? I think they are. I feel that these complaints are related to that date, yes. Defendant's counsel, I object on the ground this is beyond the bill of particulars and obviously outside the pleadings.